The Department of Paediatrics at Monash University has a rich history of research and education and providing excellent care for sick children. Founded in the 1960s, the department has grown to become one of the largest and most respected academic paediatric departments in Australia. Located at the Monash Children's Hospital, it has been at the forefront of connecting paediatric care with the best research and education. Over the years, it has continued to make great strides in improving the lives of children and their families. Key to the department's success was its founding professor, Professor Emeritus Arthur L Clark, one of the most influential figures in developing world-class children's services.
Did they take you on a tour today, Arthur?
Yes.
What stood out today?
I got lost wherever I went.
Professor Clark was appointed to Monash University in 1965 and in the decades following cared for thousands of Victorian children.
I was actually involved in designing the first Monash Medical Centre, and that's the way I think of Monash Medical Centre. And then I come out here, I can't find it, and the children's hospital's here, which it never was, and what's worse, everybody speaks in initials.
Since Professor Clark's time in charge, the department has undergone many changes, from technology to patient experience to the role of paediatricians themselves.
At Monash, I'm a developmental paediatrician, which is a relatively new subcategory of paediatrics, or subspecialty. And predominantly, I will see children in the outpatients department. What I love about it is that it's very multidisciplinary.
Dr. Kirsten Foley is a paediatrician, dual trained in community child health and general paediatrics, who is completing a PhD and working as a paediatrician scientist. She has a strong interest in child behaviour and development, sparked through her undergraduate degree in natural sciences with a psychology major, and through her medical and specialty paediatric training and current research.
I work in a clinic with a psychologist and a speech therapist and a teacher. And with the breadth of experience, I think we really are providing excellent assessment and recommendations for these families and children. Now, where I'm working, it's very multidisciplinary and it's very collaborative within other specialties. When I was young, a trainee or more junior, and I was working for other teams, I think it's quite hard to see the bigger picture. You're very much involved in your specialty and you do the tasks for your list of patients. But I think as you get more experienced, you realise the huge importance and benefit of the collaboration between different specialties and talking amongst colleagues, respecting the multidisciplinary approaches.
Monash University, in partnership with Monash Children's Hospital, has invested heavily in the latest technology, including surgical robots and sophisticated telemedicine capabilities, with which doctors can consult and train remotely with other specialists.
I've been here at Monash for 20 years, and when I first came to Monash, Arthur, we had a lot of equipment then as well. The equipment at that time used to be big boxes. Remember the old VCRs and all that? They would every monitoring bit would be in big size, and the baby would be in the middle of those monitoring. You can say all the artillery around them in a very small space. The preterm baby in the middle, and lots of big equipment around.
Associate Professor Atul Malhotra is a consultant neonatologist at Monash Newborn and a clinician scientist in the Department of Paediatrics at Monash University. Atul's clinical research interests focus on improving respiratory and neurological outcomes in high-risk infants.
Now what's happened, Kirsten, is that all those equipment are integrated and they are so slick and small, just like our smartphones are, that they are in your pocket.
Monash University and Monash Children's Hospital have made significant strides in improving the hospital environment for children, from colourful murals to play areas and fun outdoor spaces, creating a welcoming environment for children and their families.
I noticed there are lots of efforts that, for instance, the moving images on the walls all over the place, which are quite fascinating. I could stand and look at them for ages. I hope they distract the families a bit.
One of the beauties about the Monash Children's Hospital, when we built the Monash Children's Hospital, Kirsten, I don't know if Arthur has seen that, is we built a mock MRI suite. So when the child is going for an MRI of their brain or heart or lung or whatever, we have a mock MRI suite where they can actually go and play with the machine and get a feel of what it's like to be in that MR as compared to going into the real magnet. Because I don't know if you've been into a magnet, Arthur, but it's quite daunting. For 45 minutes or 1 hour, you will be in this space where no one else is talking to you and you've just got this continuous hum going on. These children in the past, Kirsten, would have to be sedated and anesthetized to get into the MR. Our rates of sedation and anesthesia for these children because of that mock MRI machine has gone down by 50%, and it was presented and, won a lot of awards, that research from our radiology department, where basically they just kind of, get the child accustomed to what it's going to be like in the MR, do a bit of a feel and play, and then get into that machine. So the amount of sedation, anesthesia and reassurance you would need is much less as compared to previous.
Anecdotally also, I had one particular child who was minimally verbal, had very few means to communicate, but was highly stressed in many environments. And we thought, I wonder what the chances of success will be for this young person having a really important neuroimaging of his brain, which we needed to try and achieve. And through the mock and through a play therapist that really managed to ease the stress, this child was able to complete the imaging, which everybody felt was going to be unachievable. Perhaps in the past it would have been a simple case, sedate and take the image, whereas we were able to achieve it through the mock, through play therapy, without sedation, and it was a fantastic outcome. I understand that you've seen the current Children's Emergency Department.
Yes, I have.
And I'd be interested to hear how that's changed.
That's changed enormously. If we go back as far as the Queen Victoria Hospital, casualty, as it was called, was just a large room, and all patients milled through that. And in fact, when we moved to Monash Medical Centre, the first casualty, which dealt with all age groups, was just an expanded version of that. Now I've just walked through what you call the ED, I understand, and there are the patients in individual cubicles with infection as a major determinant of why this has happened. Very different.
The Department of Paediatrics has come a long way since it first opened its doors. With the latest technology, a more holistic approach to care and a welcoming environment, it's no wonder it is a leader in paediatric care in Australia.
As far as I'm concerned, I can just stand back and see with amazement how much has happened since I retired. And I suppose, I hope, that there's nothing to stop it going on, continuing to become more and more of a major centre.